Hello. So I was just thinking about, well, I did a pre-check-in for tomorrow. The only doctor I'm actually going to see is a nutritionist. So, it had a little questionnaire beforehand, and it had all my diagnoses, and it did not list PBC at all, but it did list cirrhosis without ascites. There's not a lot of evidence that I have cirrhosis. And I know I sound like that person. I know I sound like a know-it-all. But there really isn't, and my hepatologist agreed with me that there really isn't a lot of evidence. But they really keep holding on to it. And it makes me extrapolate, like, there's a lot of people getting diagnosed with cirrhosis right now. Young, old. It's just, for some reason, cirrhosis is just like, skyrocketing to the stratosphere. Like, everybody has it. I'm like, do they? Because, like, they aren't listing my PBC. So where did the cirrhosis come from? I don't drink. I don't. It would have to be from the celiac, right? That's the only possible thing if it's not the PBC, because cirrhosis just doesn't come out of nowhere. And I have done nothing in my life. I do not drink. I've never drunk. I don't like to drink. I've never developed that taste. I don't like the burning. I don't like beer. I don't like wine. I want wine to taste like grape juice. It does not. Now, I know, like, this is part of my being a picky eater, but I've never wanted to develop that taste. There is no alcohol that I like. I don't even drink, like, a hard lemonade or any of that. Although if I were going to have a drink, I'd have a girl drink or a White Russian or something. Like, I've had alcohol, but I've probably had less alcohol than the average 15-year-old. I just don't like it. And I don't like cigarettes. And I do indulge in cannabis, but I don't smoke it. I do edibles, which even the doctors at UCLA are like, yeah, we encourage people to switch to edibles. So I don't think I have cirrhosis. I think I had liver damage from my celiac, and I think it's getting better every day. But they really want everybody to have cirrhosis, it feels like, and okay, the portal hypertension. It's possible to have portal hypertension without cirrhosis. It's possible because my liver got so damaged from the celiac, because I just for years would use bread. Like, if I felt sick, if I had an episode, I used to call them flares because I thought that I had IBS. So whenever I would get a flare, of course I would have buttered toast or saltines or oyster crackers or soup. All of these things full of gluten. All of these things made it worse and worse and worse and worse for years. So yes, I believe that there is liver damage. I believe there's even some fibrosis in there from all that, sure. I don't believe I have cirrhosis. I just don't have any symptoms. And now that the jaundice has gone away, like, why? I don't understand why they're holding on to this diagnosis, unless it's just that my justification for being there. Because, even the first doctor, there were a few things that she said that really reassured me, and it's why I'm not terrified to go tomorrow, because I don't think I'm going to need a transplant. I don't think I'm ever going to need a transplant. Now, I don't know that. We still have a lot of imaging and stuff to do. But it's just the sense I'm getting. There were a few things she said, and I'm going to try to recall them. But again, it's been a week. One of the first things is when she came into the room, and she's like, so you have cirrhosis. And I was looking at my labs at the time, and I was like, well, there's not really a lot of evidence that it's cirrhosis. And she said she agreed. She did not know about the PBC. I showed her the mitochondrial AMA results. They were like 150, which is really high, but PBC still isn't on my... So I don't know, is PBC a real thing? I mean, I'm not saying it's not real, but there are some doctors that think that some conditions are not real. Like, some doctors think like fibromyalgia and chronic fatigue are not real. They're sort of situational conditions. I read an article about it where they don't really have diagnostic criteria for it, but like there's collections of symptoms that are similar enough, so they sort of put people in this box, like it's fibromyalgia. And especially because women's diseases, autoimmune disorders, are not as well studied as anything that men have. And that's just the truth. Like, that's just the way it is and the way it's always been. It's changing, but it's not changing fast enough for, women right now. There were two other things that she said that really comforted me, and of course, like, they're slipping my mind. But, I don't understand what, I mean, that's why we're here to ask, no, we're not here to ascertain whether or not I have cirrhosis. I think in terms of, because starting the process and going through all of the consults, now it's just testing after the first consult tomorrow. I learned with the transplant coordinator nurse, with a social worker, and then the next day with a psychiatrist. Their job is not to ascertain whether or not I have cirrhosis. As far as they're concerned, I have cirrhosis and I'm getting a transplant. All they're there for is to make sure that I'm okay to get a transplant. And this is what's frightening to me, because I don't believe that I need to be in this program. And everybody's telling me, like, no, you should be in this program. You should be doing this. But I'm like, this is a program for people who need liver transplants. I do not need a liver transplant. I am taking somebody's place who needs to be there. Now, if it does occur that I'm just extremely compensated and I have, like, cirrhosis, I'll eat my words. That's fine. I have no problem admitting I'm wrong. But I don't think I am in this case. I think I'm lucky enough that yes, I had malnutrition. I had vitamin deficiencies. I had problems for years. But as soon as I start addressing them and taking the meds and eating gluten-free and eating better, working on hydrating, working on addressing those deficiencies, taking the supplements, taking the pills, going to the doctor, doing all the things, getting the exercise, going outside and getting vitamin D, I'm getting better. Cirrhosis doesn't get better. And I wasn't even really sick. I was just jaundiced. I mean, and other than, the bathroom stuff, which is the celiac. So, I wish that the doctor had halted the process, but again, she does want to look at the things like the portal hypertension, the swollen spleen, and, things like that. I get it. I question why cirrhosis is listed but PBC is not. And I wonder, and I know PBC is a real thing, of course, because I've read PubMed articles about it. There are plenty of doctors who believe it's a real thing. And I'm not saying it's not. I'm not saying it's not. I have no medical knowledge of that. But I'm finding little weird inconsistencies with different doctors. Doctors who are gastroenterologists, who are internists, who are hepatologists, who are not really saying anything about the PBC, and it's making me wonder what's going on with that. Why that's not listed, but cirrhosis is. Because, like I said at the beginning, where's the cirrhosis coming from? You don't just wake up one day and have cirrhosis. Cirrhosis comes from somewhere. And in my case, it would be the PBC. But if they don't list that, and they only list the celiac, it's like, I don't know. It's weird. There's just weird little things that I don't know. And again, this is probably me wearing a tinfoil hat. And I'm not freaking out as such. I'm not scared about tomorrow. I'm a little bit like, I don't want to do it. But I'm not scared. Because it's just going to be tests. I've done tests for the last few months. I'm used to it now. And I never thought I would be in this position, but I'm grateful for it. Because I don't want to be scared of tests all the time. So I will have no problem going to the doctor from here on out, because I've done this before. I've been here. Once I've done something, it doesn't scare me anymore. Anyway, it's just a weird thing. I don't like seeing the word cirrhosis. I don't like that it keeps getting thrown at me, and I don't feel like it's appropriate. I've got 3 seconds. Have a good week. Talk to you later.